Hey guys, my name is Dr. Ilman. I'm a physical therapist. Today I would like to talk about what are some normal physiology that you can see in a micturition. Micturition is a process of urinating. So when someone is urinating, the detrusor muscles, which is by the way innervated by parasympathetic innervation, which means you have no control over it, the detrusor muscles needs to contract during micturition. In other words, detrusor muscles need to contract during urinating, but the pelvic floor muscles needs to relax. Okay, so if the detrusor muscles are not contracting, then the person will not be able to have full emptying of the bladder. That's number one. If the detrusor muscles are not contracting, and if the pelvic floor muscles are contracting, right, that is also a problem. That means that person is not going to be able to have, like they won't be able to efficiently, like their urine is not going to be coming out fully. For example, if you are contracting the pelvic floor muscles, right, you will stop the urination while you're urinating, right? That's where the Kegel exercise is coming, right? That's the whole idea of Kegel exercise, which is when you're urinating, you're holding the urine. While you're holding that urine, your pelvic floor muscles are contracting. So we don't want that, right? So for us, for the urine to flow smoothly, your detrusor muscles needs to contract and your pelvic floor muscles needs to fully relax. If the pelvic floor muscles contract, that's when you hold the urine. That's when the flow of urine gets interrupted. And we don't want the flow. We don't want the flow of the urine to get interrupted, right? So we don't contract the pelvic floor muscles. We relax the pelvic floor muscles, but we contract the detrusor muscles. And again, detrusor muscles are innervated by parasympathetic innervation, and pelvic floor muscles are innervated by sympathetic innervation. As you know, sympathetic innervation is fight or flight, where parasympathetic innervation is something that you don't have any control over. For example, the fact that your heart is beating, you have no control over that, right? That's your parasympathetic innervation. Just like that, the detrusor muscles is innervated by your parasympathetic innervation, which is also very synonymous to internal sphincter. So internal sphincter and detrusor muscles, they two go hand in hand. So we want the internal sphincter and the detrusor muscles to contract during micturition, or in other words, during urination or micturition. This is the same two synonymous word. We want the detrusor muscles and the internal sphincter to contract, and we want the pelvic floor muscles or external sphincter muscles to relax. So remember, pelvic floor muscles and external sphincter muscles, they are both same. So sphincter is, as you know, it's the process, like it just opens up or it closes down. That's the function of sphincters, right? So pelvic floor muscles or external sphincter muscles, they both go hand in hand, and internal sphincter and detrusor muscles, they both go hand in hand as well. Hope that helps.